Yeah, I started donating blood as soon as I was old enough, like when I was 18, I think it was. I really find it's a rewarding thing to do, and I feel that I'm making a contribution. And then I also give plasma in between, because I can give blood, and then 4 weeks later I can give plasma, and then 2 weeks later I can give plasma again. So it's a really big, important thing in my life that I can do this. When I came to have my implant, and he determined that I would need a bone graft, and I wanted to know what it would be. And so I did ask those questions. I wasn't unaware of that. I did ask him the questions. What is it, and will it preclude me from giving blood and plasma? And I just accepted that, and I decided, well, it's important that I get this bone graft. I'll do this, and I'll just be excluded for the required number of months or years, or however long it is. Yeah. Yep. I'd be very unimpressed, that's for sure. I'd be very disappointed. I'd be very sad about that. He said, this particular bone graft should not be a problem. Probably 3 years. But by doing that, by going through this process at the blood bank, the nurse rang the medical officer that they have to consult if there's an exception to exclusions. And while she was doing that, I was ringing reception and trying to find out what the product was. She then spoke to the nurse, and she wrote down all the details. Then she spoke to the medical officer, and she said, yeah, that's absolutely fine. And so it was plain sailing from there on. But they did talk about the implant registry. They said, are you on that? Or would it be registered there? And I said, I really don't know. If patients are having implants, and if they are having bone grafts and they are blood donors, I mean, maybe it's a question you can find out in your, your intake forms or whatever. Is this patient a blood donor? I guess that would be also useful if a person wanted to, if they're in a situation where they wanted to donate blood, bone marrow, or an organ, or donate a kidney or something. It'd be important to have that information about what the bone graft was. Point of view, if I was having it again, I would hope that I would be asked if I would like to have my information on the registry, and I would want to be informed about how to access it and what the point of it is and how it would be useful to me. And I'd also want you to ask if any of your patients are regular donors of blood. Then it's more relevant to them what the products are that you're using on them. And if you have information about the blood services exclusions and processes to give to your patients, I think that would be useful too. Because from my point of view, if I knew that I was going to be excluded, say for 3 months, I would give blood the day before I come to have my dental work, so that they can have as much of my blood. I would do that as a priority, or I would book in my dental procedure to be just after my next donation, so that I was excluded for the least number of donations.